ज्योति स्वरूपा जगदीश्वर विश्व की ज्योति जग जाए जो मन मन स्वरूपा जगदीश्वर
Check your laptop or jump or software issues. Software lo update ಇದೆ. ಇಲ್ಲ ಅಂದ್ರೆ ಸರ್ ಇಲ್ಲ ಕಟ್ ಮಾಡಿ ಇದು ಮಾಡೋದು ಲಾಗಿನ್ ಮಾಡಿ ಇನ್ನೊಂದ್ಸಲ ಮಾಡಿ ಲಾಗಿನ್ ಆಗ್ಲಾ ಮತ್ತೆ Starting video.
ಮೇಡಮ್ ನಿಮ್ಗೆ ಇದು ಬೇಕಾ ಇಲ್ಲ So you need chair or yes, ma'am, please. A warm good morning, one and all here. See, competition is great, but we have seen that collaboration is where magic happens. And today we are seeing such one of such collaboration where the RAAOUS team at ayuryogamrutam hospital is conducting a session, and it is creating a space where individual strengths blend beautifully into collective achievements. Whatever we gather today here, let us make it a practice in our own clinics or in our own practical life, so that whatever time she has given for us, it's worth it. I, Dr. Archana, feel privileged to invite you all for this brainstorming session by Dr. Balatripurasundari. And Dr. Pushkala Madam will be introducing her to you. Before that, we all know Albert Einstein, who is known for his research. He says, if we know what we are doing, it's not called research. Wouldn't be called, because we already know it. It is on occasions like this, we get to test our knowledge and understanding. So we look forward to get an exposure about what the best of the brains think, so that we can also make use of such ideas, or how to practice, or how to make use of the principles told in our classics to present day scenario. So I would like to call Dr. Pushkala Madam to introduce our guest speaker for today.
Welcome all. It's a great opportunity to host you all. This was, this is our first, Gita Madam and us. After starting, we were thinking of hosting some talk like this, but it is a privilege that I am hosting Dr. Bala, my bestie. Dr. Bala and I were classmates in BIMS. I have learned throughout all these years. We did our BIMS in 2005. Learned a lot. She has done MSc counseling psychology. She has done MSc counseling psychology. She has diploma in yoga. She has done, and she has been giving lots of talks, health talks for general public for their benefit, conducting lots of camps. It's almost 20 years of practice, and she has benefited, especially during COVID season. We have seen that even patients from ICU contact her and then got relief, in their conditions. She has been awarded Vaidya Ratna Award in 2023 and Ayuryogamrutam. That is Arbudhamangai is Wonder Woman in Tamil. Ayurveda Arbudhamangai in 2019. So these awards are a little bit to define her, but as such, coming to her clinical practice and her life, she lives the Ayurveda life, everything from her kids to bringing up her kids, the diet that they take. Many things she thinks in Ayurveda and she lives Ayurvedic life. I'm so, privileged to introduce her. She also treats lots of autism cases. Many people fly from different countries to get treated. CKD cases, all different. She is also blessed to get all different cases, and she does that wonderfully well. very different cases, unique cases she has got where she discusses she is also a marathon runner. So she has lots of sports people as patients. So basically, she started marathon for that. She started seeing marathon females who were obese and taking treatment from her. When you give kafara treatment, they were actually increasing in weight. So that was one of the reasons that she also started marathon running, and she will tell you her experience in that, where she has improved performance and output of many sports personalities also. I'm so happy to introduce you, Bala. Please. Thank you.
Yes. Happy morning to one and all. Initially, Dr. Balatripurasundari, she introduced. Thanks for providing this opportunity to share my experience and the way of thinking of Ayurveda. Initially, what I used to suggest is live Ayurveda. That's it. So you have to think all kinds of. You have to think as a Panchamahabhautika composition. Whatever we are seeing and whatever our Prakriti, whatever it is, we have to see as a Panchamahabhautika composition. So by this way, we can learn and learn a lot of knowledge through Ayurveda. So wherever we are, we have to pursue by this way. This is my concept. Also, follow the Guna concept. I hope you all heard Dr. Mahadevan sir. So, based on his concept, Guna concept, wherever what are the disease, we can able to treat and we can able to think in that aspect. It gives a lot of different perspective of certain conditions. So in that way only I have approached this chauffeur. So already she mentioned about the runner, no? So I got a set of patients for chauffeur. Yes. Females usually whenever they start walk for about 2 kilometers or 3 kilometers, definitely they'll become obese. Their weight gets increased. Well, whatever we are doing physical exercise, it has to reduce weight, but controversially it increases the weight. So there I was thinking, what is the reason? What is the reason? Because of the Rukshatvam in their system, already the Kleda Srotas worked a lot, that becomes dry. The Snehatvam of our system will get dry. So without replacing Sneham, we can't able to work properly. So every other function we need Sneham. So Kaphatvam has to address there. So in that aspect, I studied Shofam from thoroughly, but anywhere it is not related in that aspect. So this Shofam, which stage they are in, so I couldn't able to find out initially. Then I thought about this Panchamahabhautika constitution and also compositions and all. Then I am able to relate in that Panchamahabhautika composition. And Gunavat also I can able to win. Then only I find treated, I gave Snehapanam. Even though I give Snehapanam, their symptoms will get flared up. So what to give? At one stage I was very puzzling. So in that aspect, Mridu Sneham, Alpa Matra Sneham, we can have some kind of a Chirabala or some kind of Rasayanam like that. Sneham, that is an Alpa Matra, that lubricates the system and it won't increases the inflammatory markers. So by gradually, by over the period, it lubricates the system. So even though they are a very Krisha or Stula Dehi, we can give Mridu Sneham and Alpa Matra Sneham. There are few cases who is having verting, continuously taking verting for vertigo problem. So in that cases also Rukshatvam and Rasakshayam will be there. So in that aspect, I treated this Shofa case. Then it got relieved and they can able to run now with the Snehapan. And often I used to prescribe Vasti. Only Vasti, not Abhyangam. Without Abhyangam, I used to prescribe Vasti. So with the help of Vasti, they attended a international marathon also. So they performed well in that cold condition also, because when the Shita atmosphere will be there, whenever it is there, environment, definitely our internal system will get dry. Rukshatvam will produce. In this climate also, Rukshatvam of internal system, because when internal system gets dried up, definitely the functioning capacity will be altered. So in this climatic condition, what we used to face is a lot of acidity cases and different kinds of hormonal changes cases. So in that aspect, the Pitta Vardhanam will be more. So in this aspect, I treated that Shofa case. Now they are good. So their Vata Vardhanam will also under control. In this aspect, I implemented in CKD also. CKD, we all treat, we also give Punarnava Kashayam, Gokshuram. Where to give Gokshuram and the way to give Punarnava. So this is a very big task for Ayurvedic physicians, because the Kleda Pravaham, Kleda Dosham will be, the Vikrita Kledam will be eliminated through our urinary margam, Mutra margam. So in that aspect, what we have to do is polyuria. If the polyuria is there, definitely we should prescribe Punarnava. Because Punarnava is Ruksha Ushnam. So Ruksha Ushnam, Kashaya Tikta Madram. So it will reduce the, even though it produces Mutram, definitely the Mutra Margam the functions of the Mutra Margam will get corrected. In polyuria cases, we should prescribe by this way. If the Vata Vardhanam is more, in that cases, we have to prescribe Gokshuram. This is the very critical analysis we couldn't able to find out. So in the wherever the kidney disorders stage 3 and 4 are going, what we used to prescribe Punarnava always, because it is a Mutralam, so we have to prescribe. In that cases, Gokshuram has to prescribe initially at one stage. It gives Snigdam also and Shitam, but it is a Mutralam. So then we have to reduce and the Gokshuram and then give Punarnava. So in that aspect, Rasayanam has to prescribe a kind of Vastyamantaka Kashayam and Karaskaragutam. Those are a Tridosha Haram, along with some kind of a Shunti Chudnam, because always we used to concentrate on Agni. For that, Shunti Chudnam can able to, if we add Shunti Chudnam, definitely the function of the kidney will get improved. So these two medicines and Dashamulam becomes a very good Rasayanam. So Trina Panchamulam, we can prescribe Trina Panchamulam as a Paniyam also. Whatever we are seeing in the CKD, we have to interrupt with Vataraktam. So Vataraktam, in similar way, Vataraktam, we have to treat this CKD, because Kevalavadam Avranam along with Pittajam and Raktajam. So in case of a CKD, lot of increase in albumin levels and creatinine levels also. This is the creatinine, uric acid and urea are all malarupa of Kledatvam. So in that aspect, what we can do is liver. The albumin is produced through the liver. So Agni Deepanam plays a major role in that aspect. So then in another aspect, during the when the kidney gets dysfunction, functional wise, when it gets decreased, definitely hemoglobin level will not gets decreased. So to improve those things, to address those things, what we have to do is side by side we have to improve the rasam and the raktakshayam. Also, we have to address the function of kidney. Just we have to support with either Kokilaksha Kashayam or Punarnavadi Manduram. Thus, and by prescribing this Vata Haram, Vata Rakta Chikitsa, we can prescribe these kinds of medicines. Along with that, just give simple based on the Prakriti. If the Prakriti is Thula Devi, definitely we can provide Abhyangam, Kiri and Panchakarma therapies like this with Basti. Vasti makes Punarnava Gokshuradi Vasti is very effective Vasti. Then along with either kind of Vata Haram and Rasayana Chikitsa has to concentrate through Vasti. Because all the medicines can't able to digest through the mouth orally, and because the Agni is very mandam, they can't able to digest properly sometimes. So in that aspect, what we can give us through Buddhamargam, through Vasti, we can attain easily all the necessary needed things. So always prefer, I used to prefer Vasti. Often I have to, often I used to prescribe Basti because the intermittent, without Abhyangam also I used to prescribe Basti. That gives general well-being of an individual. So the quality of the living will be, definitely gets improved. So in that aspect, definitely Basti helps. Because sometimes the patient may be a Krishadehi. Krishadehi, we can't give any kind of Abhyangam and all. In that aspect, to empower the quality of the living, definitely we can give Vasti. By providing Vasti itself, their quality gets improved. So by cut shorting these kinds of treatments, we can achieve little ahead. So by this way, usually I used to treat CKD chikitsa. Then whatever our acharyas mentioning, Kleda, especially Kleda Hashtotas has to maintain. For that, Agni and liver has to concentrate. If the Mutra Magam gets stuck, if it is not working, we have to choose another Margam of Buddha Margam. So for that, Nitya Virachanam has to address. So if we prescribe Nitya Virachanam, definitely it helps the kidney to get function. It retrieves the kidney. So by that, by this Nitya Sneha Virachanam has to prescribe. So this is grossly I used to prescribe and maintain about the CKD. So any other suggestions from you? It's always welcome because I can able to learn a lot.
Including Varuna, actually, we already see that Varuna is we
Yeah.
always think about soap, and also whenever Mutra was this we just like how you told Punarnava, one more drug which
Banana. It's in Vastyamyantaka Kashayam. So by combination of Tridosha Haram, we have to always address. So by in that aspect, single drug can't help. So by the combination of other drugs also, Tridosha Haram has to prescribe.
So you are suggesting that when we are giving Basti, we can make use of this Vastyamyantaka as Sneha in that Basti.
Yeah,
What would be the Kashayam?
Kashayam as a paniyam. Either Kokilaksha Kashayam paniyam, and because it is Vataharam and Rasayanam too. Also, Vastyamyanta Kashayam paniyam I used to prescribe. Instead of water, they have to consume this Kashayam as a paniyam, Nitya paniyam. Yeah. So different paniyam, if we prescribe, the intake of water also gets limited. Also, it heals the system very gradually. Agni will also get corrected automatically.
Already they would be suggesting that water quantity should be reduced.
Yeah.
Instead, if we can suggest.
Instead of a plain water, they can consume this water.
What is the ratio of blood paniyam and
For the product is as such, what we are using is The Gokilaksha Kashayam is there, no? The remade product. 30 ml for 1 liter.
For 1 liter.
Yeah. So that is the proportion usually I used to
Anyway, they
prescribe.
will be taking a maximum 1.5 liter a day.
Yeah.
1 to 1.5
1
liters.
to 1.5
45
liters.
ml kashaya are giving.
Yeah.
With
1 liter Kashayam with
1 liter.
yeah.
That means 30 ml.
30 ml.
Ragi are giving us. Okay. Okay. Then you can sneak the sneha rate. Sneak the variation. You mean to say like Sukumaragruta and
Gandharvastari Thailam is wise. Along with processed with dhanyakam and yeah, that is Mutra Virajani. Dhanyakam along with no dhanyakam, make it dhanyaka kashayam and along with methi. Make it kashayam and prepare as a prepare as a Gandharvastha mixed Gandharvastari Thailam. Make it as a Thailam. For a Nitya Sneham, I used to prescribe.
So that what you are telling, along with Gandharvastari Thailam,
Dhanyakam and methi kashayam.
We boil it and Thaila.
Yeah.
You
Yes.
want to make it as Thaila Paka.
This will reduce.
Nephron rejuvenation.
No, sir?
Nephron rejuvenation. Usually
Nephron.
each kidney contains 10 lakhs of nephrons.
Yes, sir.
Once nephrons died, means almost 9 lakhs died, remaining is only 1 lakh. During that time, creatinine level is very high.
Yeah.
If completely died, all nephrons are dead, means how to rejuvenate nephron, any particular rasayana to rejuvenate nephron,
Karaskara Ghritam makes us I used as
how
a
fast we can rejuvenate in 1 year, 5 years, 10 years. Like we can, if serum creatinine goes more than 5.5, they won't bleed, they won't stay in iron.
yes, sir.
They will advise for dialysis. So at that condition, we can maintain it, or still we can refer the patient to dialysis, what to do, whether the rejuvenation is possible with our medicines through rasayanas. How much time it will take?
One case I have seen a quick result of Karaskar with the help of Karaskar Ghritam. Within 1 month, the creatinine level shows a drastic improvement. But for another case, which is having liver failure also. So in that case, I couldn't able to get that much result because the in first case I mentioned no. In that case, only kidney failure was there. In the second case, liver failure also was there. So in that case, I couldn't able to get that result. So based on Agni Deepanam, after giving the Agni Deepanam, only we can able to get the result. So for that, we have to always follow this Agni Deepana process and Rasayanam has to prescribe. For SLE cases, those who are having this CKD, high protein excretion. So for that also, fatty liver will be grade 3 or 4 stage. So for that also, Agni Deepanam itself creates a lot of changes in their urination.
Usually, cases what we are getting is CKD because of diabetes.
Yes, sir.
So that is the biggest cause we are facing here. Almost they are coming at last stages when they advise dialysis, they will come to Ayurveda. So that is the biggest cause.
Let us try.
Otherwise, they come after dialysis also. What are you checking? Is there any?
Yeah, that is wise because when they start dialysis, we can able to give a lot of support for them. We can reduce the duration of the dialysis. That is more wise thing. If we are treating with some kind of allopathic physician by tying up, by providing a single set of dialysis, after that the kidney gets retrieved. Also, there is a breathing time for that. Simultaneously, we can give our medicine and give bastis and all. By this way, togetherness, we can give a very good result.
Do you suggest any standard protocol in people who are on long time dialysis?
Yeah, definitely.
Ayurvedic protocol that you have a standard that you have standardized.
I didn't standardize it because I'm working on this aspect. as of now, I have seen single dialysis, and after that, they can able to sustain their life. Quality of the life is very good after single dialysis along with Ayurvedic medicine. Continuous dialysis means definitely their dialysis quantity and quantity gets lesser. Yeah. So frequency also, time duration also getting lesser. So what they observed is today your kidney is what the patient mentioned is the time duration of the necessary of the medicine, quantity of the medicine gets lesser. So something is doing your medicine, but I don't know how to interrupt. So this is the statement they mentioned about whenever they're taking Ayurvedic medicines. So we have to work on this along with allopathic physicians, so those who are doing dialysis, definitely. Those things will possible in Karnataka, but it is not possible in Chennai. So I'm struggling in this aspect.
Everywhere it is same situation.
Okay.
One part of the people will be there who are accepting that Ayurveda is good.
Okay. If definitely if God time permits.
The urologist will tell don't go to Ayurveda.
Sir?
Urologist first condition.
Yeah.
No, I will not treat them.
I will
Definitely. They only.
But hepatologist also is printed in the bottom of the page.
Don't take Ayurveda.
They don't take Ayurveda medicine. If you take Ayurveda medicine, you won't take.
Instruction they like to
For that's why now NCSM has brought up with a mail ID, so you can mail such.
Yes, we can come.
Even
In
EGS.
EGS,
Bangalore.
sir, very
There is a
commonly
big
you will
part
see
of
in
pharmaceutical
EGS.
research.
Yes.
You just combine.
No, so one case we got the doctor told us Ayurvedic medicine induced hyperthyroidism. This I had put in the group once. We got called from NCSM head and all. They thought we will proceed with the case. If you want, we will help you and all. They have,
So now it is.
so now the support is there. Immediately next they changed and then did a idiopathic. So we have support. Only thing is we have to stand.
One more approach is this, madam. In creating metabolism is through muscles. So what our approach is, we will advise patient to reduce their muscle mass.
Yeah, definitely. For
Like in the
that,
marathon and other things.
yeah, definitely.
So
Those
because if we
vyayam
have
will
high
help.
protein content, then only the creatine level will rise. For that, we have one more method. We will have Bilva Thaila. We will only prepare Bilva Thaila. So we will advise patient to take Bilva Thaila Abhyangam. So light, little bit Abhyangam, like only very small amount of Thaila they have to take. And they have to take Abhyangam. And live steam. So the issue is we have 3 malas to go, from Sveda and Mala and Mutra.
Clear them.
Already we have done Mutra Marga is already obstructed. We have to take out Mala from either Sveda through Mala Marga. Mala Marga, Nitya Virechana is a good approach. So we are also doing it. And one more is Sveda Marga.
Svedamala.
So muscle creatinine will come out through the Sveda. So by applying Abhyanga with Bilva Thaila and little steam. So that is also possible. We are postponing. So once in 2 days dialysis, we are postponing up to once in a week.
Yeah, that
Once
is
in 15
happening.
days. That is possible. Bilva Thaila. Bilva Thaila.
Yes, in Shita Desham, definitely the Svedam is essential. But in Ushna Desham, that is not
In
necessary.
Bangalore, we are
I think you just stand like that and start refusing.
Definitely.
Other cities are all good.
in Sveda Vidradi will happen. That is the main issue. We cannot do in Chennai and in Bangalore we can. Sveda Vidradi will happen in Sweden.
Svedam.
Then Bilva Thaila Abhyanga is necessary or only it's Sveda?
Always
Bilva Thaila Abhyanga is-
Sveham has to apply before Svedana.
Because oil should enter inside the muscle only after doing Swedana. Oil will enter muscle mass. Creatinine will reduce. First and foremost goal is reduce the weight, muscle mass. Second, little bit Abhyangam and other things we are doing. And Rasayanas we have to plan. Bokshura is the best Rasayana what they have observed. So we'll give Bokru Kada. So completely prepared 5 liters can we give direct to the patient. They should use whenever they want to drink water also they should take
When
Bokru Kada.
Amutram is there, oliguria is there, definitely we can give that.
And Shilajittu many times you use some patients for rejuvenation.
Always Rasa Kshayam and Rakta Kshayam used to
And
address.
from this one embryologically point of view, Rukka is made up of Rakta Meda Prasada. So we will give you Rakta and Meda Pachana Dravyas and as well as Rakta Vardhana and Meda Vardhana Dravyas for rejuvenation of nephrons. So one folklore practice in Chennai, not in Chennai, in Tamil Nadu, so it is very famous one. Everybody will go there. So I asked what they are giving. So they will give you meat from a pig meat, and as well as the medas from the pig. Along with that, they will give abraka.
Okay.
Abraka and the pig meat is the and the trivanga also they will add metal. But in some patients we have tracked the result. In some patients it is good, in some patients it's bad. So creatinine is 3.5. After taking the medicine, it has been to 7.5. Some patients it is 4.5, reduced to 3.5. Like. But how they are preparing the basma depends on that results. Trivanga basma along with Varaha Medas. The concept is only Rakta Meda Prasada Tulko.
Yes.
So Rakta and Meda Pachana we have. So Rakta Pachana
Any
Meda
medicines they
Pachana.
are giving for Pachana directly,
Directly. One bottle they will give, it's 100% water, just like this one. In that they will mix the
Abraham and
and they will give.
where they needed Pachana, in such cases it might not be giving result.
Yes.
Where there is
Agni
like,
Deepanam and
They won't analyze the patient. They are completely a folklore.
then we can divide it.
They won't see the report also. The patient comes with kidney failure, they will give the medicine.
okay. So in that aspect,
Ama is that most that time it is not.
Ama, the condition they won't analyze.
So in such condition, it is getting worse.
In CKD, results depends on in which condition patient comes to us.
Which phase?
In first phase, second phase. Creatinine levels are good means we can treat. Agni is good, we can treat. Liver and digestion system is good, we can treat.
But have you come across CKD with other organs involved?
yes, ma'am, liver failure and splenomegaly.
What about this cardiac involved?
Cardiac, ma'am, I didn't face that. The cardiac
Hypertension
involvement,
induced is most difficult to
Yes.
treat, madam. Congestive cardiac failure, hypertension induced kidney failure, complete loss. Almost all nephrons dead. We can't do anything.
with the hypertension, it is too difficult to treat.
Hypertension induced CKD is most difficult. Even in diabetes, induced, very slowly it will attain CKD. Hypertension is already fast. Patient doesn't know he has a CKD. He knows only when they check the creatinine level, it's already crossed.
Also, potassium level also gets decreased for that.
Electrolyte imbalance is there, and it has multi-organ failure, cardiac involvement, liver involvement.
Multiple organ means definitely we have to drop the case because it's not wise to choose the patient to treat.
Maybe they come under Asadhya.
Yeah, definitely. Even CKD itself, Asadhya Rogam, we can able to provide only Shamana Chikitsa. It's not a curable one. Even though if it is not a curable one, we are treating those things. We are trying to achieve something else. So the multiple organ failure means definitely we have to declare the patient, or else just we have to support the quality of the result.
We can feel that when CKD patients are advised to reduce their fluid intake, many of the patients, just in your area where it is completely Ushna, they come up with UTI very commonly. Because the fluid content which is going inside to flush the basti is also reduced. And the external environment is also creating the situation to create UTI. What would be the right choice?
Ghritam, because Ghritam is the first drug of choice whenever the UTI is repeated. Because the Snigdhatvam is lost there. Because of that, the infection is getting repeatedly. So we have to do Snigdham there. Stanika Snigdham can also do. We can able to do. Tichu. Taraskara Ghritam. Yeah. Or else But now I thought of
What
what
male
is,
patients also restricted in the working that.
for that we can internally we have to. For male patient we can't give pichu when that is not useful one. So repeated washing and concentrating on providing snigdhatvam to the sharira with the sneha. Tikta, always choose tikta rasam.
Daily.
Ah, Shamana sneham is advisable. Shamana, most of 15 ml is enough because Agni also gets most 1 or 2 months. Nitya sneham is always advisable for these kinds of vata prakriti.
Same gratam.
Same gratam, or else if you want like Dhadimadi gratam, it is a Muda Vata Haram. So based on the symptoms what they are having, if the Rasakshayan is more, we can choose Vidaryadi gratam. So based on that, we can prescribe. Dhadimadi is for both for Rasakshayam and Raktakshayam.
What happens nowadays, some patient will come after 3-4 months, every time they are going, they are taking 4 days, 5 days injection, again 2-3 days, same infection repeated. So to avoid
UTI.
UTI.
For common people, not for
That's
along with the diabetes. For that, we have to give this Gokshura, the Guglu or Chandraprabhavati. So in a higher dose, no 4 tablets like that, 4 tablets for 3 times. In higher doses, we have to prescribe.
both.
Yeah,
For duration.
duration for 1 week. Yeah.
You should,
Yeah, definitely. For that, initially we can, if the dosha is a vata pitam, we can choose Brihatyadi Kashayam, which is Rasayanam also. So Mutra Margam will be, it is a very Mutralam also, Brihatyadi, Vata Pitta Haram. The Kapha dosham is, the infection is very repeated along with the Brahmanam. We can prescribe, what is that? Varuna. What is that, sir? Start with Kashayam. Varanadi not. Vastyam. Just I didn't get that. Let you know.
Typically, we come accommodate the hypertension. Hypertension induced CKD.
Yeah.
And diabetes induced CKD.
Veerataradi Kashayam. That is Kapha Haram also. Veerataradi.
I can understand.
By prescribing Veerataradi itself, it eradicates the repeated infection. There are a lot of cases who went for this infection, repeated infection. In female cases, vaginal infection causes UTI, repeated UTI. That also we have to address.
Madam, do you use Karaskaragrata as a part of Nirogamasti?
Yes, ma'am.
And what Kashayam do you use?
Punarnava.
Okay.
Or else Dashamulam.
Again, it doesn't depend on Punarnava or Moksha.
Yeah, Dashamulam. Yeah,
Depending on
definitely. For that, Rasayanam or Dashamulam is best choice.
I remember you telling me that without Abhyangam in marathon going for Basti.
Yes, ma'am.
Any particular?
Particular reason is to absorption will be very faster. Especially they need not to spend a lot of money. That is enough.
Money economically, I understand, but how come? I would like to hear, when you talk about the Kshina patient,
Yeah.
I can understand without the Abhyangam.
Because the inflammation will be very high in all muscles. So if we start doing Abhyangam, some patients will emit a lot of inflammatory markers. They will get a release. During that time, Yeah, without,
eliminated Sweden.
no, it is not sufficient. Yeah. In that cases, what the patient suffers is they used to get fever. In the first Abhyangam itself, they used to get fever. After that, we couldn't able to continue for runners especially, and especially for Krishadehi and Atita Vatavardhanam, associated with some other acidity and all, what they are getting is fever. So when the inflammatory markers is very high, after doing Abhyangam and Svedam, definitely we have to stop the treatment. That is very Ushna. Yeah, again we can't provide a Ushna. So for that, Alpamatra Sneham is essential. Alpamatra Sneham, and we have to lubricate the system initially. Then only Vata dislodge will be automatically happens. So in that stage, we can give Abhyangam. So for that purpose, I used to prescribe without Abhyangam, you can take a Vasti. So immediately after Vasti, definitely the Vata will gets reduced. Also, it absorbs each and every cell of the system, so it is very effective.
It's like fast food.
Yes, ma'am, definitely.
Instant,
Instant relief we can provide.
instant relief, and in GP also we can practice it.
And in this discussion of without Abhyangam Basti, in OPD level for Matra Basti, if patient is coming, would you advise them to take food in front of you and then you administer, or how it is done?
No, ma'am, I used to prescribe Vasti left and right because with or without food, I used to give Vasti. It affects.
So what is the quantity, ma'am?
Usually-
OPD level, somebody is coming and immediately you are giving.
80 ml, 80 to 100 ml. Because anyhow, Vasti, after Vasti, Vata gets eliminated. Along with that, certain amount of oil definitely it gets also gets eliminated. In that aspect, around 10 to 20 ml will be out. So the retention will be 80 ml definitely. So Acharya has also mentioned 80 ml is wise. So immediate effect will be there.
So alternative day, if you're giving for some consecutive days, you call the patient every day, or one alternative day you suggest?
Daily.
Daily.
Yeah.
So before giving the next day Vasti, would you ask them, ma'am, what time they evacuated the earlier day? Or
Yeah, definitely. What are the changes they experienced? They'll tell all kinds of symptoms.
Changes? and
Yeah,
what all they
changes. What are,
observed?
yeah, definitely. By seeing the patient, we can able to assess at an extent, no. So I used to point out those simple, small changes also. So they'll get confidence and symptoms also gets reduced.
Can you share any one case, ma'am, like that? In Turan, they reported with leadless. With Vasti.
With Vasti, initially, in which case?
Marathon runner case.
Even in my case itself, my personal experience, I used to wear Vata Prakriti. So I used to get a lot of problems, whatever the system from top to bottom, I used to get a lot of problems. Initially, I took this Grita Padam. Then that was not sufficient. So I started to take Vasti. The moment I took Vasti, I can able to feel in the Kanta Pradesham. The oil gets absorbed till it reaches till the Kantam, because the taste used to feel. The lubrication within each and every cell, I can able to feel it gets rejuvenated. Something, the dried up muscles also gets lubricated. So my functioning ability and the performance, my chitta level, everything will be altered the moment I took Vasti. So this is the observation of myself. Also, whenever I take Vasti, the next day I can able to run with whatever the kilometer is, even 5 kilometer or 10 kilometer. My capacity will get improved definitely.
Matra Vasti we can give to any duration, any time, any matra. That's why it's called as Matra. Even in give 60 ml, 80
Ah,
ml, it's 1/4. What we are telling you, 40 divided by 3 becomes 80. 80 ml Matra Basti you can give any number of times, any number of
Yes, sir.
at any time.
Yatha Saukharyam we can give.
You can 60
This is
ml,
the advantage
60
of
ml.
our Matra Vasti. So I'm very fan of Matra Vasti.
Actually, Dr. Bala had low calcium levels in college days. And then suddenly when she was in preliminary,
Hypoparathyroidism, partially.
and she started getting
Itchings.
this one. Then after some time when they were in trip also she got, and then almost her memory, I don't know, it is miraculously except Ayurveda, many things she has forgotten even in her personal life. So in that cases, they were prescribing lots of medicines. She is someone who is totally into Ayurveda. She stopped medicines. I used to scold, but then she was never taking one tablet. She'll open, she'll put it in dustbin. That I have literally seen that. So from that condition now to this position, even during that time, when you call, she may not remember many things, but somehow the prescription, the talk, the advice would be always correct. From that stage, it is Snehapana and Vasti that has basically revived her.
Initially,
So
what I consumed is Cheruvadi Kashayam and Vaishwanachunam. First, I addressed this Vata Vardhanam and Agni Deepanam. Then later, the later part, what this Cheruvadi and Vaishwanachunam will do means, it eradicates Vatam from the Shiras. So it eliminates all kinds of Vatam from our system. It also kindles the Agni also. It also empowers the Dhatu Agni too. So in that aspect, I started with the Chiruvilvadi and Vaishwanara. Along with that, I took Snehapanam. So by Snehapanam, I used to drink a lot of, especially initially I took Guglu Tiktadagratam, and later stage I was maintained with Indukantam and Vidaryadigratam. So complete Vataharam and Rasakshayam, Rakta Kshayam I addressed. Then later part, I didn't even take Kalyanagrutam. So usually whatever the Medo, this Shiro Rogam, what we used to prescribe is Mahakalyanakam or Panchagavya Gritam, like that. So I didn't take this Panchagavyam or Mahakalyanakam. Till now I didn't take it. But so Medo Rasakshayam and Raktakshayam I addressed. Till often I used to take Vasti. Immediately after Vasti, I can able to see the difference of my.
Only the Matra Vasti?
Yeah, Matra Vasti. Yeah, without Abhyangam. I didn't take even a single Abhyangam. So,
is there, for example, say we keep for 7 to 10 days Matra Vasti?
No.
There's no need for even one Kashaya Vasti?
Not necessary. Yeah. Matra Vasti is user friendly.
Yeah.
So often that is not regular Matra Vasti. I didn't take regularly also. But often only I used to take either 1 or 2 days. So in that aspect, when Kampavatam also got cured, because the patient was very lean, Ati Krishaha, so he can't withstand that much Abhyangam and all. So initially I suggested one Abhyangam and Sneham, Swedam. Then for every other week I prescribed this only Matra Vasti along with internal medicines. So that works a lot. He can able Kampavatam, initially I suggested Danam from Meldupakam. Yeah, that is complete Vatahara.
Only for Basti purpose.
Yes. Yeah. All companies are manufacturing this. Then Kshirabala and Himasagrataiga. That's enough. Himasagrataiga.
Because I have one patient which is having Kampavata. It's on allopathic treatment actually. The patient came for this Kapine Jivadata. He is not able to talk so much. But after starting this Haridiki, Shundi and Buddha,
Nasyam is wise.
like Nasyam is
Yes, ma'am. Wise treatment is Nasyam and Shirotalam.
which Nasya usually
Shirabalam. Shirabala. Always the Shirabala is best for Rasayana purpose.
already patient with Kapha Buddha, no?
Yeah, but we should do
Initially, we can prescribe, Anutailam, then later part we can prescribe the Shirabala. That Lala Prasekam happens because of the Rukshatvam and increased Pittam. Because of that, they are having a Lala Prasekam and all. So, if we subside this Vatavardhanam, then we can automatically this gets cured.
So that time we can go for the second one.
Yes, ma'am.
So that is a good choice.
In cases of children, autism or reading,
Yeah.
such practices of below 10 years, between from 5 to 10 years, Matra Basti
Yes, ma'am. It's very effective. Really, that is my favorite treatment. Simply giving Bhyangam and Svedam with Matra Asti. So this is a very good method of a treatment for providing a immediate result. Immediately after giving Basti, the hyperactive will get reduced immediately. They can able to feel the difference immediately. So that is wise.
Choice of Kailan ma'am in such conditions.
First choice is Dhanvantram, then Kshirabala. Because always we have to do Vataharam and Rasayanam perspective. For autism cases, what I used to practice is always Agni Deepanam gut theory. So Sneham of gut. What we have to do is always do Snigdhatam to gut. So in that aspect, the Vata Haram and Pitta Haram happens, then automatically the Snigdhatam fatty acids will be more. So Kapha Vardhanam, we can't give Kapha Vardhanam because they may provide some kind of Mandatvam to them. So always give Vata Pitta Haram, Agni Deepanam, because lot of Agni Mandhyam and Visham will be there. From the beginning, from the third month, we can able to diagnose this autism because their development, some kind of lagging will be there. Whatever we are, usually what we are teaching is Krishna Rama Govinda. This will not happen in third month. They won't do. Even though they are very adamant, those adamancy will address for leads to autism cases. So, Vatahara Dravyam always we have to concentrate from the Sutika Paricharya.
So telling about weaning off at a very early stage, they will be the doctor.
First of all, Sutika Paricharya has to follow initially the whatever the mother is taking aharam. That has to be a nourishing, also a Vataharam. For that we are providing Saubhagya Shunti. Medicine part we are concentrating, but Viharam and Aharam part they have to concentrate. The patient or is in foreign countries or they should not add some other portions of Aharam. Whatever it is in Patyam, we have to follow that only. Apart from that, they should not add till the lactation period ends. So in the we have to provide a lot of knowledge about this Aharam Pakam and each and every individual of Ahara Dravyam also. So by providing this knowledge only, we can able to change this. Then after introducing one Phalaprashnam and Annaprashnam, method of preparing food is very, very important. So it should be very lagu. We should not give biscuits because nowadays biscuits is very common for in all parts of the world. So we have to suggest avoid biscuits because that is the pradhana karanam for Agni Mandhyam. So that knowledge definitely we have to.
Cerelac and all.
Cerelac definitely it creates a lot of Agni Mandhyam. If they are giving Cerelac,
No, that's what she is telling. During travel also, there are the methods what you can
Yeah, how we can switch to use other foods other than Cerelac, ma'am, during travel, especially in current era.
Because we all have given that.
Travel things will always be a hot water and a
Cerelac
cup of
box.
Cerelac box.
Yes, ma'am, definitely, because the usually there is no other way, means that we have to provide a Cerelac. After that, we have to give kind of kashayam or rupam like Agni Deepana Dravyas we have to prescribe. So if we have to run behind this this era. So we have to be always in alert, but make sure that Agni Deepana Dravyas has to prescribe.
I want to add one thing.
I add something. Equal quantity of rice and mixer, dried and powdered. Keep that as a Cerelac along with yavan. Along with
Yeah, I want jeera.
ajwain and jeera. Keep that as Cerelac, and you get small stouts. 20 years back also I used to get this small stouts and ayuryogas and Bangalore, wherein you have it immediate candles. This is how we used to prepare.
I do prepare this.
Even including on trains, you can do this.
Oh, okay.
You can, if not anything, just over fry that a little bit, even with hot water, with a little more of jeera and ajwain. Giving it without cooking is much better than giving a Cerelac with our jeera and with our ajwain. It works better. So this we can instruct our patients to do it on their own. You get the ayurveda, you get a small stove with a candle and a small cup. You can prepare it.
Wherever we go, definitely we can utilize the part.
That we are used, but travel is the main issue.
You can prepare it in train. You can prepare it on.
I roast it and I make powder. And I take dry fish powder also. I just fry it. Then I make powders. Then I take water, we keep with jeera and hing. I boil it. And hot water I mix and I give him.
Wow.
Whenever we travel.
Okay.
So I do.
These are something I think many new moms have to learn because we have already done with Cerelac.
Keep it ready and now feeling.
Yes, that's a good idea.
I do the Cerelac.
I do the Cerelac, yeah.
What are you doing? So,
Yeah, no, that's a kind of.
two reviews cover
Yeah, the topic makes the
We call it
so when it
instant energy delivery system.
okay.
And the Bakana is said to be
No, actually, we go
fencing system.
to this one, it is cheaper.
Fencing system.
Package is
We have
very
open it because
Inside effects will be there. If it is old stock, means
then I roast it.
Okay.
old stock is this is the problem.
Very low level.
Last time I used to be traveling and
Sir, daily they want for that matter they are adding dry food.
Must exercise your practice, especially in females, like post delivery, with the toddlers and all. We are encountering a lot of issues. So,
Simple matravasti is enough, ma'am, seriously. Because
what time, ma'am, especially for ongoing patients?
Dadimadikrutam. That works,
Wonders.
yeah, definitely. That creates miracles also. Because the nutritional anemia, what we are facing is repeated anemia. So in that case, we used to prescribe this Dadimadikrutam basti. So they can able to sustain without medicine also.
With this only, but
Yeah.
no oral.
Along with Annavedi Sinduram, Kasi Sabasma.
I started using another syndrome or and one more thing is the patient who Dr. Bara has treated, the first case of autism, I think it's probably first case, I don't know. He is married and then she is sitting their pregnancy also now. So such as boy started, he got a very good marks from went to a very good job, and still the whole family is the patient.
In autism and ADHD, we have to concentrate on the
Please approach to autism and ADHD.
initially, Vardhanam is there because based on the Desha, if the patient is in Singapore or they conceived in Singapore also, the mercury level will be very high because the Desha Jalam itself contains, even though when they process, even though the water is coming from Malaysia, definitely the toxic part will be there always. By that way, they are getting a lot of hyperactive child. So in that aspect, what I used to prescribe is along with Gandhakam, because the antidote of mercury is always Gandhakam. And if we introduce Gandhakam, definitely the mercury part will be gets reduced.
What form?
Gandhaka Rasayanam. Yeah. Gandhaka Rasayanam. Their skin issues also gets reduced. Hyperactive also gets reduced. Triphala Churnam along as a Pani. Nitya Churnam will have the antidote for this mercury and other metals will be always Triphala Pani. What I suggested was Triphala Pani for only for the child, not for elders. That gives a lot of effects for this child. Hyperactive gets reduced because there is no option for this for that desha. Here in India means definitely we can give Sneham and Ushna Shita Dravyam also, Medo Vardhana Dravyas, which is commonly available in that. For that, Agni Deepanam has to concentrate. Then Vata Pitta Haram, either through Vasti or through internally. Even internal system, internal medicines itself creates a lot of changes. So Sneham is essential for that. Over the period, we have to always we have to concentrate whenever we are prescribing Ghritam, concentrate on Agni Deepanam. And also Krimi part we have to concentrate. Always Krimi Haram will give a lot of changes to especially ADHD child. So simple Krimi Mudgaras and Krimi Kutaras, those things will do a lot of miracles in ADHD cases.
Dose and duration in your clinical practice.
Usually what I used to prescribe is for Krimi Chikitsa, the child is can able to swallow the tablet, one tablet at bedtime for 2 months. Nityameva, yeah.
So about 5 years or 6 years, we can give one time.
Even 3 years child can able to swallow the based on the if not syrup base. Yeah. Gandhaka Rasayanam, half a tablet. Half a tablet. For 1 month.
But what company use that also matters.
Imis is good. Imis Doodh Papeshwar. Doodh Papeshwar, I don't know. Imis is good. I'm using Imis only. Imis and Zandu company.
These hyperactive breeds now will not cooperate for the matter of in such cases what can right.
And for initially what
Forcefully now they treat like something they're harming them.
Yeah, definitely.
In such cases.
For in such cases, initially I used to give Brahmi and some kind of media drugs. So in that case, initially I used to prescribe this Manasamitravati and all. Later they can able to calm their mind, they can able to understand what we are telling, and everything will happen. In that stage only it is possible. If the patient is not cooperative, we can't give Matravasti and all. If they want to cooperate, we have to prescribe Nasyam too. While sleeping itself, I used to prescribe Nasyam because I used to suggest whenever you wake up the child, before that you install the Nasyam, install the oil through nasal part. So that will help a lot.
Which one?
Anutailam is enough, yeah.
Brahmipita as part of Matravasti.
Yeah, definitely.
And we can keep Pichol Tanushi.
Yeah, definitely. Simple application of oil itself makes a remarkable difference. So I think that will reduce Vatam and Pittam also. Simple drinking of water itself create lot of changes. Because we don't know when to drink water and when not to drink, how much to drink. So this makes a very big change. This becomes a game changer also. In the even the schizophrenia cases, whenever they are so aggressive and irritated, what I used to say is go and have a sip of water. After drinking water, they'll become calm, because the fluid content always vata pitta vardhanam, fluid becomes reduced. So in that aspect, I used to concentrate on drinking of water too. So initially, whenever we are providing other foods to the child, often we have to provide water also, because the digestion, it helps for the digestion. Also similar to the sneha. So drinking of water in this climate, definitely we have to concentrate. In Ushna Desham, we need not to say, automatically we used to consume. Because we used to miss, we won't get a thirst in this condition. So often what I used to provide knowledge is drinking of water.
In this regular weather, we have to remind ourselves.
Yeah,
because we cannot
definitely.
tell patients that only when you're thirsty you can drink water.
That is not
That is
wise.
not true.
Yeah. So what I used to suggest, whenever you are going out of our home, definitely have a sip of water and then go. Then whenever you enter into the room or whatever the place you are entering, then immediately after that you have a sip of water. Just sip of water is essential, is enough for proper brain functioning. Whatever the activities you are doing, have a sip of water and make sure that you are calm. So by that way, in all aspects, it helps.
Because this general rule is always stuck in our minds, ma'am.
Yeah,
Drink
definitely.
only water when you're thirsty and eat food only when you're hungry. So this.
Especially while having food, we have to keep a glass of water. 1/4 of the water has to sip before the aharam, and in between 1/4, then there's a half of the glass. Then after that, have a sip of water. That's it. Always sip of water helps for the good metabolic enhancer. Autism. The concept is the same. Vata Vardhanam is there. Always Agni Deepanam has to prescribe. Autism and ADHD and low IQ, everything comes under a single line. So social behavior and they used to concentrate on OT therapies and all. Along with that, what I used to suggest is Agni Deepanam and Krimihara Chikitsa, along with the Rasayana. After giving Agni Deepanam and all, I used to prescribe this Antihita as a Rasayana. After Agni Deepanam only, this creates a lot of changes. So autism cases, after providing Antihita, their social contact and communication skills gets improved.
Because
Because
cases you told by 3 months you are able to observe the change. But there are cases again after the vaccination also they are developing. Very good child after 1 year, 1.5 year vaccination is done. The child who used to talk suddenly becomes non-verbal with honesty. What is your experience?
Any experience with this vaccination will lead to autism?
yes, sir,
Any case
definitely.
studies?
Even MMR vaccination leads to this. Because all in Singapore and the US, this is most commonest problem. Because Vata Vardhanam is more. Simply by addressing this Vata Vardhanam, we can see a lot of good results in this. So by providing Sneham, Nitya Virachanam and Sneham. So this makes a lot of difference within them. The coordination and verbally they are good. They can able to feel what their bladder control also good improves, and also they can able to reach their needs, daily needs. They can able to button, then the focus will gets improved. So everything based on this Sneham itself create miracles in this autism and hyperactive.
How do you give sleep? Vasti or internal, or that age it is difficult to give internal also.
Yeah. Internal Sneha Panam is usually prescribed. Mahakalyana Vigratam or Vidaryadi Vigratam. If the patient is intolerant to sound and they are banging their head, means definitely there's Vidaryadi Vigratam will help, because Rasakshayam is there. So for that their intolerance is very high. So that Vidaryadi Vigratam I used to prescribe. In 1 teaspoon, especially in empty stomach, with the melted ghee, not along with any vastu, only Ghritam. After that, we should not prescribe Ghritam. This is based on my experience and my opinion. Prescribing ghee is always, it should be in empty stomach. Not after food, not after any kind of drink or thing.
So do you mean to say that all this vaccination, we cannot publicly say you should not take?
There was a case which happened in the court.
MMR case ಆಗ್ತಿದೆಯಲ್ಲ madam.
Sir, but
Now
still,
government hospitals
They
are
won't
also
accept,
big-
ma'am, definitely.
we as Ayurvedic physicians, we cannot publicly say you cannot take vaccine now at present. Maybe after a rule comes, we will be
They
able
are telling that MMR for time being you give it. Once
what-
this court case wins, they will start.
No,
MMR.
for all
My
kinds of
suggestion I'm
Again,
telling
the-
is,
for all cases of every other individual, whatever we can able to provide, means definitely we have to concentrate on Sneha part.
yes, that's what I was thinking is like,
Yeah,
no
one
matter
point.
whether they are taking vaccines or not, even before vaccination, we have to start with
Sneha.
Sneha so that whatever complications might
They
arise,
are
we can.
yeah, definitely. For that, Swarna Prashanam helps
Kind
lot.
of, protocol where before vaccination you come, you do this,
Yes.
after vaccination you come and do this, so that at least
Complications would.
Avoid the complications.
after 1 year you will not. So in such cases, maybe if we can prevent at a very early age.
That's what, ma'am, because
It's
now
very,
though we are
very
not in a stage to say that
Very
don't
good.
take vaccine, because it's not.
No, if something happens, then again, we have to be blamed.
Yes.
We cannot take it, not only now, even later also. Though we have known that many vaccines have caused.
Especially
Publicly,
with
we
the
cannot-
polio also,
Yes.
polio is, it's lot better now, though it might cause many other complications, at least polio is prevented. So we are not in a stage to say that
Yes,
don't take
very
vaccine,
good.
at least prevention part, whatever you are suggesting, we can.
Yeah.
Start
Sneham.
Sneha before itself.
Nowadays, more than 25 vaccination are available actually. So I am telling my patient not to take extra vaccination.
Flu vaccines we can avoid.
Every 6 months.
Not to take other.
Any kind of
They can
vaccine,
go
yes.
for- Yeah, they can go for typhoid vaccine up to 2 years if they want.
Even though
I'm
our-
directly telling my patients, even if educated or not.
Like ಬಂದು ಹೋಗ್ಲಿ.
So even
ಬಂದು ಹೋಗ್ಲಿ.
though if you are worried, no, sir,
We have medicines for typhoid.
So we
Whatever
can-
the government, WHO. or
That's all, that's all.
The government of India free vaccine is available.
New one.
No paid
Every
vaccine.
visit they will introduce new one.
Yes,
I think 5,600.
ಅಲ್ಲ, pediatrician earning is only through vaccine. ಈಗ ಅದೆಲ್ಲ ಬೇರೆದೆಲ್ಲ ಇರುತ್ತೆ. ಅವ್ರದ್ದು ಒಂದು vaccine ಒಂದು 300 rupees.
Every visit they are introducing new one.
10,000.
Yes. Yes. So usually I used to suggest after 1.5 years, don't take any kind of vaccination, not necessary. Even cervical vaccination also I will suggest.
There is no harm. Let us start,
10 years child has got cervical
Cancer.
vaccination.
Vaccination, yeah. From the age of 10 years.
Then, what safety factors? What is the need for it?
what they are selling the booster dosage. Everything is booster. Nowadays, I never heard it before. Within 2 years, this booster has started.
Because the culture of a foreign people will be entirely different. So they are providing lot of vaccination. Here that culture is coming.
Everything, sir, booster.
What you give
Dadimadi Ghritam, because it addresses Moda Vadam. Definitely. Yeah, definitely. Wherever the Vadam is there, it addresses.
Any other cause for autism other than this vaccine?
Agni Mandhyam. Yeah.
Even
Even the parents have the familial, genetical impression. the parents and their parents, his grandparents, they are very aggressive, and in the olden days, what they used to suggest is just they are so aggressive, don't tell these things. So they used to be very submissive in subsequent generation. So that also creates a lot of changes in upcoming generation. So we have to rule out those things also. In that case, when they are coming to Garbhini Paricharya and whatever the things we are providing, definitely we give awareness in that aspect also. So your father is like this, your grandfather is like this. This will create a lot of problem, but we can able to assess their genetical impression is there. So because of that, they are getting these kinds of autism and all. So autism, it's
You mentioned, madam, if they have genetic history, how to prevent autism?
Sneham itself create a lot of changes.
Before conception, we have some protocols or plans, madam.
Yes,
Before
ma'am.
conception.
Yes, ma'am.
We will advise Virajana and
Really should be like a
before
consultation.
conception.
During consumption, what I used to prescribe is Dadimadivritam and Mahakalyanavidritam along with Manasa Mitravati. From the beginning, the manas of the child will be calm. Also, the mother's mind will be calm. So after that, I should not. I used to suggest not to stop this till lactation period.
From
So
the beginning till the lactation. We will start from 4th month. Manasa Mitravati.
Regarding cause you were asking, sir, nowadays these junk food second part, nowadays they are working night shifts, no? Because I have one child which is having ADHD problem, but this parents don't know that this is ADHD. So she is not able to sleep 1 or 2 hours in the night also. Always when she will come to cleaning, no, she is running and running. She is not at all. So I have started this night Nitya like Dutta with ghee, and in the morning Mrudu with kishmish.
yeah,
Raksha. And Sneha along with food.
okay.
And along with this Mahakalyananga, they have taken for some 3 months, I think. And usually I give Swarna Prashana child, and that I provide one powder to them. So in that powder, major part is the Brahmi and Ashwagandha, Vacha and Eshtimadu. So I added Shataputi Abrata Basma to it and little quantity of Rajata Basma to it. And asked the patient to consume along with that Mahakalyanaka Dhutam. They have continued for 3 to 4 months. That running will came down and she has started sleeping. And actually, I advised for this, what she told her, like the patient is not comfortable for Matra Basti. So I advised this Talam and other things up. And actually, patient is right now good. Like that girl is now she is in 6th standard, 6 years old. She is good. But what I have seen that patients are not approaching that they don't know the history. The child is having hyperactive. So they are thinking that my child is so super active and knows the kind of.
Yeah, that is there.
Major problem, madam. Even my
Sir,
cousin doesn't know after.
Patients are so accepting that that is
If
the
autism,
problem.
we don't know. It's 4 years. It's
And
in
the
school
major-
also for 1 year.
major
But school,
one-
they were also didn't try to know, right?
Okay.
School also. He's having autism. He came to know after 4 years.
Okay. High IQ autistic child used to be there because their vatam will be very high. For that, we have to neutralize the vatam by giving this Agni Deepana and Sneham. Always, line of treatment will be Agni Deepanam, Krimiharam, and Sneham. If we prescribe in this aspect, definitely the effect will be within a week.
What about the Agni Deepana part? What it will be?
Usually, kind of Pachanam Dravyam, Pachanam syrup base, around like that. Pachanam syrup is available in what to say? Which company? Intellect syrup is comes in Green Millennium company. So yeah,
So Pachana like some syrup.
some kinds of syrup base, especially. Yeah,
Churna we cannot.
churnam is not advisable because they won't consume. Especially what I used to prescribe is syrup based, because patients' parents are gone up. First thing, they have to be very we have to make them comfortable initial stages. Then we can concentrate on other drugs, means definitely they can able to cope up with that child. Already the patients will be gone up. So for in that aspect, what I used to suggest is prescribe is syrup base. So in syrup base, if we give a kind of any kind of Pachana Dravyam and Agnidipna Dravyam, definitely it works. After that, Krimi Haram. Along with that, Mridu Sneham has to prescribe.
Any reaction like Tripura or something?
Definitely not.
Because of that will again.
This Pachana Dravyam itself create a lot of analomnam to that. So not specifically, we should not prescribe, especially deadly against Tripura Churnam for analomnam, because that itself are dry. Vata Vardhanam again and again. So I never prescribe Tripura Churnam for analomnam purpose.
Mantra Chikitsa along with any of these.
Definitely. Yeah, definitely. Daiva Vyapashya Chikitsa. This Bhuta Grahas, whatever it is, Bhuta Grahas, we have to address.
ಒಂದು ಗಾಯತ್ರಿ ಮಂತ್ರ ಸ್ಟಡಿ ಆಗಿದೆ towards memory enhancement and calming study ಆಗಿದೆ. They divided one school, they took two groups together. One group with Gayatri Mantra. Before also they assess the intelligence, and after also they have assessed it. One group without Gayatri Mantra, like they will be chanting for 100 times a day, and that group will not chant anything. They will do Akroti, but they will sit quiet without chanting. That they assess, and because the group which is chanting Gayatri Mantra, their memory power is high. The study was conducted on the school.
Even Meda Sunda for that matter, STM Hassan, Manasarva department, one of my colleague, Dr. Sushmita, she carried out study for her thesis only. She had taken Meda Sutta. She did it for 3 months. Daily chanting of Meda Sutta, and before IQ was tested, and after 3 months. And now it has become regular in that school that every child will be chanting Meda Sutta.
Oh, good. And this COVID also will help, sir.
Omkara.
Last time I had social one case Down syndrome. Same case I'm treating. He is actually good. He's well built, 4 years. Like he had hyperactivity.
Any chromosomal disease?
Microcephalic case.
Chromosome.
Yes. Microcephalic case, chromosomal microcephalic case, it is giving a very good result. Its coordination and activities will be gets improved. Down syndrome I didn't take, sir.
They paid all and they used for Abhinda for almost 1 year. So a lot of improvements with that in that case.
Siddhanta, classically what we are observing, Apanavata we give control to improve Pranavata. That is a Siddhanta. So approach is also the same. We have to control and maintain Apanavata to functioning Pranavata. That is a Siddhanta. Yes.
Yes, sir.
Any case of this
Of course.
No, it is a scam. They make it like that, but they don't.
What about CP of hyperactivity? Though that is everything is hyperactive. You get.
Initially, one more thing has to concentrate, because regulation of Bhatam is already we have concentrated on that. Communication between parent and child is essential. So that makes a lot of difference within the child. Either with the parents or grandparents. We have to give a lot of knowledge regarding this.
1 lakh.
So by providing knowledge on how to communicate, what to communicate, whatever they are communicating, what are the stories they are telling? By telling stories itself, they give lot of changes. Because simple Kaka story itself create lot of change. Because we have to provide knowledge regarding this also. Simply what they are doing is nowadays, they are giving medicines. They are expecting results in this aspect. They are not at all doing any kind of activities or any kind of initiation. Simply they are taking to OT and other classes, speech therapy classes. What they are doing? They are also trying to
In speech therapy classes or classes, their language would be English, and here mother tongue would be
something different. Yeah. So in that aspect, what they are, what the kids can do, there is no use. So eye to eye contact has to develop through mother only. So mother has to initiate lot of initiation through this activity. Simply what I used to tell is some kind of exercise like this. So they follow these exercise. Usually we don't know for brain exercise or not. So those kinds of exercise. Kaka, mama, two-letter words. So like this, we can suggest a lot of stories with this. So by explaining stories is essential. Storytelling is a main part to in this treatment.
Suffered a lot with their
It is very
go to the child like this one combination. Then I have created many dummy cases.
20 years experience.
No Marma Chikitsa. Just applying oil and everything. Whatever the oil you use, like simple Vata, that's it. Like Shirapala was. So do Marma Chikitsa. Oil has to concentrate in this aspect. So with this, we can give a lot of changes. First of all, your mother has to be calm. Then mother's has to be calm. A similar way, if the mother is calm, definitely she can able to give calmness to others. Providing calmness to mother is essential.
Actual scammer.
Maybe
some years you will build with some.
Not necessarily. At one aspect, we can give Kalyana Churnam and all for elders. Aghara Karbam is working very aphasia itself cures. The patient is not at all speaking. With the help of Aghara Karbam,
She gave to them.
Aghara Karbam and interactions.
She went outside.
Always we should not use along with Gritam or some kind of a Sneha.
Someone came like this. They called me. I was doing the video. They called me asking that you tell me like
yes, ma'am, definitely. Based on this, if the patient is like this, Sheetam also will work a lot. Yeah, minimal dosage. Yes. The one defect is prescribing asavas. It penetrates it always Vata Vardhanam and Pitta Vardhanam will be there. It's a very Tikshna. So based on the Prakriti, we have to assess. Yeah, definitely. Definitely, I never suggest this. Always phlegm comes from nose means Vata Pitta Vardhanam is there within the system. It's not Kapha. So my concept of treating sinusitis is this. Always what I used is I never prescribe Kapahara Dravyam, Kinchit Kapahara Dravyam and Vata Pitta Haram is I used to concentrate. In this aspect,
here maybe Kapha has to be there. I don't know.
Vata Vardhanam is a lot of Rukshatvam will be there here. So you have to address Rukshatvam here.
You said to use an anti-salam. Usually are like Pitta Pradhana. So if we give medicated like they will not take kids. So mothers will mix along with food. like they prepare sweets like.
We have that
We
concept
have
is
the
there.
concept is there.
Concept it is there, we can give.
But you have to give an
If it is given, it is better.
Yes, ma'am. Better result will be there.
Then you cannot, you can go for Achaparna. Which are the snacks?
So my blood and immediate water action will be same. If it is mixed with food, so anyhow, action will be
It takes
same.
long time, that's it.
Yes, and that will be not be same. Directly that apana vata will be addressed immediately. They give
Which are the snacks?
Huh?
We need scissors.
Caesars. So Caesars always Vataharam. Vataharam Sneham is enough.
That naturally whatever is used.
Huh?
What will be used along with that medication?
Along with Agni Deepanam, along with this modern medicine, Agni Deepanam, initially we have to do Dhatvagni Deepana Dravyam. Then we can prescribe along with that for 2 to 3 days we can give Agni Deepanam Dravyam. After that Agni Deepanam, immediately we have to address this Sneham also, this Rukshatam. So with the help of Sneham, Vataharam will happen. Yeah, Masti. So that is enough.
And your experience with Saraswata.
So some patients will tell, sir, usually 3-4 times patients, still medication also is getting abortion. When that patients.
Anulomanam has to concentrate. Yeah, always Anulomanam has to concentrate.
One medicine.
Some kind of Anulomana Dravyam has to prescribe.
In conventional patients, along with the medication, modern medication, I started with Pancha Arvida Churna. Pancha Arvida Churna. It is giving results. So it is delaying the
Episodes.
conversion episodes as well as duration of episode is delayed. So, half spoon to guys.
Along with the
Water.
water.
For that, what I did is now I made Gluta and Caprari.
Yeah, that is vice.
Tomorrow I can, like, next case comes, I'll start with Gluta. But making the Gluta is too costly.
Okay.
100 ml, it becomes about 500 to 1,000 rupees.
Okay.
Those are the
What happens is already modern health consumer now I 100 ರೂಪಾಯಿ ಕೇಳಿದ್ರು ಸರ್ 100 ರೂಪಾಯಿ ಅನ್ನೋರು ಇದ್ದಾರೆ ಅವರು ಅಲ್ಲಿ ಹೋಗಿ ಲಕ್ಷ ಗಟ್ಟಲೆ ಇನ್ವೆಸ್ಟಿಗೇಷನ್ಸ್ ಖರ್ಚು ಮಾಡ್ತಾರೆ ನಮ್ಮ ಹತ್ರ 1000 ರೂಪಾಯಿ ಅಲ್ಲ 100 ರೂಪಾಯಿ ಕೊಡಕ್ಕೆ ಯೋಚನೆ ಮಾಡ್ತಾರೆ
ತೋರಿಸ್ಕೊಟ್ಟಾಗ ಸರ್ ಅವರಿಗೆ ವಿಜಯನಗರ ಒಂದು ಯಾವ್ದೋ ಬಂದಿದೆ ಸರ್ they are tied with some Bajaj company. They will give fund to patient to take a treatment.
Any particular.
In Sahasra Yoga, they are having Mahakaryanagata tablets. So I think that is easy to prescribe. Yeah. So Brita tablets are coming a lot. So we can utilize that also. Because simply in Nitya Sneham we can prescribe
So
that
I am
aspect.
using the same thing, like Gluta. Same thing.
Saraswati, sometimes this Arishta form will increase the Vata. So with the help of Arishta, definitely hyperactive may increase. So I never suggest Arishtam in Ushna Ruksha Desha. Initially, I was practicing with Arishtam. I'm very much fond of Arishtam. But after starting my practice, I stopped to prescribe Arishtam because that much it is advisable. In Bangalore, Kerala, Bangalore, Kerala, that is drug of choice is Arishtam. Yeah, definitely. Always we have to concentrate on Sneha part also. There's a lot of changes.
This again I want to do.
And your practice in yoga Sneham.
Yeah, definitely. Yeah.
Any examples of medicines that you use? Prepare or
For fibroid cases, adenomyosis cases, always I used to prescribe this Yamaka Sneham only. For SLE cases, Vishtaka Sneham I used to prescribe. SLE cases, SLE, Vataraktam, Whatever the cases which I couldn't able to prescribe medicines, or which I couldn't able to pin particular point. In that cases, Vata Vardhanam will be there all over the body. In that cases, I used to prescribe Mishraka Sneham. Immediately after Mishraka Sneham, 1 or 2 doses, definitely this Vata Vardhanam will be come down. Yeah. In a hyperactive child also, initially some for ages of 14 to 14, 15, 16. In that cases, for kids, I used to prescribe Mishraka Sneham. Ghritam, Thailam, Vasa, Majja.
Ready-made
Ah.
we are getting capsules also.
Yes, sir. That helps a lot. Immediate Sneham will be there. Based on that,
SDM
yes.
You need to be careful.
very long.
The dose you have to take. One patient complains so 1 year every night she had some.
Yeah, definitely.
So 1 ml to 5 ml, we need to decide.
My usual dosage will be 10 ml. 10 ml. For Mishraka Sneham. Once a day.
Morning.
Early morning.
Early morning empty sir.
Always I used to prescribe Sneham in early morning only.
Early morning will be covered around, like how it is about Sneham.
Vata,
Early morning,
Adi,
Apakta is Vatakala.
Basically, system will be empty. Yeah, system will be empty. In that aspect, we can prescribe this.
So how about the evening?
Definitely not, ma'am. Because what they are having as a food, we don't know.
Usually I'm second food. Otherwise,
If the Pachanam is not good, definitely Agni Madhyam and Amam will happen. Kind of a mood of hunger will be there.
So not to prescribe in the evenings.
Avoid it.
But usually we tell them eat.
Yes, ma'am.
Hunger you take go, so it's better only.
If it is in case of kids, sometimes they won't take food in lunch hour, or the quantity will be very less, the activities will be more. So automatically their stomach will be empty. Immediately after returning home, usually I used to suggest that time, because after that they will be in home. They can follow whatever they face the changes of Ghritam. So that is wise. Because in school going children, we can't prescribe Ghritam in empty stomach in the early morning. That is very much difficult to parents. So in that aspect, I used to prescribe.
In adults, it's vice versa.
Yeah, definitely.
We told we cannot assess that. Nitya Rasayana ma'am, that you suggest.
Ksheravalla.
Internally as well as to.
Yeah.
Nanism.
Yeah. Ksheravalla, Thailand. Thailand of Monad. Yeah, definitely.
That one becomes with us.
Drops, either a drops or capsule form, because parents can't afford a lot of much time and they don't have tolerance. Yeah, yes, sir. So whichever is possible, I used to suggest.
Sir, vegetarian dialogue, sir.
Yes, sir.
Non-vegetarian,
Yes, sir.
because we don't get oil capsules as vegetarian. If it comes for vegetarian, 50 rupees per capsule. Vegetarian capsule making itself goes for 8 rupees per
Yes,
capsule.
It's not,
No. Every capsule.
Gelatin capsules is non-veg.
It is made from gelatin only. If you want vegetarians, you should specially order vegetarian capsules also. Sir,
There are patients who is avoiding this gelatin capsules, even capsule form.
Genetics is from non-vegetarian. We are vegetarian. Genetics itself is
Sir, again, gelatin is good for body. because it improves your joint strength. Anyway, you take, a patient takes 4 to 5 tablets, capsules a day.
ಅಲ್ಲ ಏನಕ್ಕೆ ಹೋಗ್ಬೇಡಿ
ಅದೇ ಒಂದು ಜೈನ್ ಪೇಷಂಟ್ ಬಂದು ಬ್ರಾಹ್ಮಣ್ ಪೇಷಂಟ್ ಬಂದಾಗ ನಾನು ಅಡ್ವೈಸ್ ಮಾಡ್ತಿದ್ದೆ. ನಾನು ಹೇಳಿದ್ವಿ ಇಟ್ ಈಸ್ ಮೇಡ್ ಫ್ರಮ್ ನಾನ್ ವೆಜ್ ಕ್ಯಾಪ್ಸೂಲ್, ಯು ಆರ್ ರೀಡಿಂಗ್ ದಿಸ್ ಅಟ್ ಬಿಕಾಸ್ ಅವ್ರ ಧರ್ಮದಲ್ಲಿ ಏನೋ ಮಾಡ್ತಿರ್ತಾರೆ. ಐ ಡೋಂಟ್ ವಾಂಟ್ ಟು ಸ್ಪಾಯಿಲ್ ದಟ್.
Definitely. They used to return the medicine also.
You should take care. Yeah, because we should respect their community also.
ಬೇರೆ ಕಡೆ ಗೊತ್ತಾಗ ನಾನು ಸಪೋರ್ಟ್ ಮಾಡ್ತಾರೆ ಸರ್. I will not told me that like.
Sir, ಈಗ Himalaya you have seen tablets from ಬರ್ತಿದೆಯಲ್ಲ, most of the drugs previously they were into capsules. It is because of a Jain person writing letter to the Himalaya company. You said it is herbal and you are giving a gelatin capsule. How is it? Right anta. Then they started converting to like tablets. Capsule.
Any other question related to autism or CKD?
I mean, they know whether the toddlers and until 12 years of children, they have always stuffy nose. And appetite will be, when we ask the parents, they say they eat food with hunger and all, but the stuffy nose and sneezing, this is all throughout the year almost. So, from your insights, what would you?
Allergic rhinitis, allergic bronchitis.
First thing, Krimi Chikitsa. Second, side by side, if we are doing Krimi Chikitsa, Agni Deepna will happen. So, Sneha Dravyam has to prescribe. Simply by following these 3 Chikitsa Sutram, we can give a lot of results. You can see.
In this condition, Sneham, what choice, ma'am, do you have?
Sneham, based on this, means definitely Kshitabula helps a lot, or a kind of Gandharvastha Thailam with Mridu Sneham helps a lot. Then kind of this is enough, I think.
Last time.
Brahmi Kheera, leafy vegetable.
Yeah.
That part as a
Like Brahmi or Mandupalli?
both it helps.
Which form you can give it?
As a Kheera Koot, like by mixing with
Curry.
curry is not. By mixing with dal, coconut and all.
That's not like semi-gravy.
Semi-gravy, that is
Yeah.
dal type. Chutney tara.
Chutney we can make.
Kapu and chutney.
Yeah.
Many other dishes.
Tamburis. Popped grains we can be used. Like popped wheat, popped
When they use major Ashwayana,
What should be very
ADHD.
You start with always Agni Deepna Dravya. Yes. And Nitya Sneham. Especially for ADHD, Nitya Sneham has to follow. Every other seasonal changes, we have to give a kind of a mridu virechana, and every other time we have to make sure that the system is very lubricated. So in that case, definitely we can overcome this ADHD.
Especially Bala has given uninterrupted 100 series talk. Almost it's totally they have celebrated the 100 series also. Basically, to have a healthy life, this for public, not for doctors, and that's a free service that she has done. Uninterrupted. That people who they have told that we have changed our lifestyle, we have changed our food after listening to her, and we are having a better life. So I think from lifestyle changes, it is much more we want to hear.
From Bangalore, a case of lumbar spondylosis I faced. Still, she is in Bangalore only because She was approached me for a lumbar spondylosis. Severe back pain, sciatic pain, everything she mentioned. She diagnosed as her relatives all are allopathic physicians. She repeatedly asked for this low back pain only. What I suggest is initially I was treating for this lumbar back pain. It was not sufficient. I suggested everything, but her way of talking itself very slow and very nidanama இருக்கும். Skin and everything will be normal. Yeah, because here the Sheta Pradesham skin will be normal, but the internal system will be gets dry. When I addressed Rukshatvam, an acidity problem and digestion improved, then her low back pain also improved. Then after providing Manasamitravati, she was perfectly all right. Simply I prescribed Manasamitravati and Ksherabala.
You are telling about Ksherabala Thailam.
Thailam, yeah.
Thailam. So kids may not take like that. Can we go for other format? Because Grutam also they do
Capsule drops along with this.
For dosa also we put castor oil and
Yeah.
for kids, that's the easier way.
ನಮ್ಮ ಮನೆ ಗೊತ್ತಿಲ್ಲದ ಕ್ಯಾಸ್ಟರ್ ಮಾಡ್ತಾರೆ ರೊಟ್ಟಿ ಗೊತ್ತಿಲ್ಲ ಒಂದೊಂದು ಆಯಿಲ್ ಯೂಸ್ ಮಾಡ್ತಾರೆ ರೊಟ್ಟಿ ಕ್ಯಾಸ್ಟರ್ ಫಿಕ್ಸ್
ಅದು ಬೇಗ ಆಗುತ್ತೆ.
Castor oil, yes. Katrika Katrika. Best medicine for sciatica. Vartaka along with castor oil. Chakradatta reference. The best medicine. Huh? Nitya for sciatic itself. Parijatam and Erandathailam. Patrasvarasam or Kashayam, which are the form, along with Erandathailam, drug of choice.
First drug of choice.
Dose 30 ml, 30 ml of Kashayam and 20 ml of this Thailam. Yes, immediately relieves. Always my Thailam part, Sneha part will be more. Parijatam. Whatever it is. Swarasam is more guru. So I never suggest for Swarasam. They are not ready to get Swarasam. So if you're prescribing this Kashayam, definitely they will utilize.
I just wanted to share one with the treatment of autism, what ma'am was telling, where everywhere there was more of indication with the Sneha. But we always encounter that when we are giving continuous Sneha, child learns to Mandhyatva. So generally what I do is, it's like we tell them to give, like if at all they are taking a continuous treatment of 1 month or 2 months. The schedule is like they'll have 2 days of Abhyanga, 1 day of Udvartana, 2 days of Abhyanga, 1 day of Udvartana. Like this is how we start. Along with this, as Pachana, whatever is given, that is given. And then I specifically go with Virechana always. Because Virechana is the one which helps in Apanamata, also Pranamata if it normalized, and Indriya Shuddhi is very good. But we need to make sure that there's a Madhya Shodhana, not Tikshna. Tikshna always aggravates the symptoms. So that is one is. And if at all there is a vaccination, post-vaccination, if you're finding autistic certain kind of things, I generally give Dushivishari Agala and along with the Shivisharishta, because this has really very good effect whenever there is a vaccination induced.
So can we give for all the vaccinated kids as a
Yes,
preventive
we can.
method?
As a preventive, we can give.
Because we don't know who
yes.
is going to end up in autism.
Yes, yes, that we can give.
Vilvati Gutti calls
Like if the kid is from 5 to 10 years, it is below 1 OD.
Yes.
1 OD, 1 tablet.
Doshi Vishari, Bigandi Gutika, Shirishari,
Yes, sir.
But we should educate, sir, otherwise they will misguide. After taking those medicine, it is happen.
Yeah, yes.
First you tell,
Sir, how
Eventually, if everybody starts doing, they'll have ideas. One person does know that's it. And the program, the way or maybe you know.
Yeah, giving this medicine
Now they are
after
starting
vaccination, yeah.
project.
Immediately after.
Post-vaccination.
Otherwise, some school and you know, study
Immediately
Immediately after. Before itself we can start. We should follow this protocol before and after 1 month. Yes.
Ma'am, I
We
have
are-
one patient, like my relative only, she is around the 3 years old kid. Her mother did lot of exercise and yoga for normal delivery, but ended up in LSAS. So the child is took Hombale, and I have given Swarnaprashana to her. Child is now is very like irritating nature, and she's hyperactive. She's very much intelligent also. She will talk. She will read your mind also. That kind of she's my relative only. So what I need to, because they don't listen me. So I will send to Geeta actually. Next time to the
Simple, what she mentioned is right, because often Sneham and Vata Harachikitsa has to always follow. By doing asanas and dhyanam during the pregnancy, in excess will lead to Vatam. That's why she underwent LSES, because Vata Vikritam happened. Apana Vata Vaikunam happened.
For second baby, it is order right? For first baby. Also, as a preventive, from the 7th month itself, we can give Anvasana.
Yes.
Aram se
Sukumara Ghritam is helps a lot.
And I've given quite of the patients where I've started them giving Matra Basti. I tell them it's very limited dose, just 50 ml. not
50 ml is enough.
Just 50 ml.
position or any other special position you have done?
Usually left lateral position learn kodadu, but it is generally told to be in little position for by rate that.
Right, practice part of
I am
the
practicing as a left lateral only because they are very comfortable in sleeping. Because one I also scare that when this sleep like this, it is told that the cord around the neck is a very common complication which happens. ಇಲ್ಲ ನಾವು ಹಿಂಗೆ ಬೆನ್ ಮೇಲೆ ಮಲಗಿದ್ರೆ ಕಾರ್ಡ್ ಇದಾಗದ ಚಾನ್ಸಸ್ ಜಾಸ್ತಿ ಇರುತ್ತೆ ಅಂತ ಹೇಳ್ತಾರೆ. ಅದು ಕಾನ್ಸೆಪ್ಟ್ ಇದೆ. It will also help in normal delivery. Other than that, it will also help in avoiding all these issues. If at all I find, because since I have more of psychiatric cases, see, like for example, if the parent is having anything like mood disorders, for sure the next generation will have anxiety issues or OCD issues or something of that. For sure, it will be nothing. So for them, for such parents, I in advance I tell them from the 7th month itself, 15 days till 8th month. Then 8th month every week I tell them to take Anvasana Basti. So that helps a lot. Yes, I do. Yes, but
Less patients because of my area, but I've started
right.
Jwara and Matra Basti, will you practice?
No, ma'am, not advisable. After post-viral only, we can give Matra Basti. Because now, nowadays post-viral effect will be more. In that case, we can give Matra Basti. Because the dry cough and fatigueness, weakness, everything will be more. So in that case, we can give Matra
High
Basti.
temperatures and all.
Definitely.
Only overall.
Yes, Agni Deepanam only.
The vaccination is sold Sneham to give them, Daddy Mari to them. If in case some children will have fever after vaccination, so.
And immediately after, we should not.
Yeah, that's what.
If the fever is there, definitely we should not.
Wait for
One,
days.
wait for a day. Then during that period, either Doshi Vishari or Vilvadi, orally we can give. With the help of that, fever intensity will be reduced. So automatically we can give after the subsiding fever, definitely we can, because the inflammatory markers will be very high during that.
So any drug interaction, like immediately if we go one thing. And the second, that effect of that medicine, whether it will going to, because the common question will be asked for the parents. How it spread.
No, ma'am, no, any kind of drug infection I didn't observe. Yeah.
And what about the efficacy of that vaccine will be?
Vaccine maybe gets reduced.
Because
Vaccine effect may gets reduced. Anyhow, it works. So the adverse effect will get reduced with the help of our medicine. Definitely.
Can we give after 1 month?
Not necessary, ma'am.
No, not like our medicines.
Yeah, not necessary. Immediately you can give.
48 hours.
No, why I'm telling, let them have the effect of whatever the medicines.
For that purpose, we are prescribing Doshi Vishari and Vilvadi. Always we have to.
ಡೌಟ್ ಮಾಡ್ತಾರೆ ಅಂತಂದ್ರೆ ಆ ಟ್ಯಾಬ್ಲೆಟ್ ನ ಪೌಡರ್ ಮಾಡಿ ಇದು ನಾರ್ಮಲ್ ಬರೇ ಒಂದು ಗಿಡದ ಪೌಡರ್ ಅಂತ ಹೇಳಿ ಕೊಡಿ ಅಷ್ಟೇ. ಹೌದು. I generally like that when patients are too intellectual, they will like cross questions. I just make it powder, mix it, and it is just 1 or 2 herbal medicine ಅಷ್ಟೇ. ಯಾವ ತರದ ಪ್ರಾಬ್ಲಮ್ ಕೊಡಲ್ಲ. Take exam. They take for that.
Name also and they'll Google it.
Yes, they do.
Now Google patient has.
They do that, but you have to be smart in the class.
But the cross-checking doctors is their more problem. They will take this question from me.
Yes, all the
Post-viral arthritis.
Post-viral arthritis. Yeah, definitely. Amartotra, Rasna Irandadi.
Joint pain. ಜ್ವರ ಬಂದು 3 ದಿವಸ ಒಂದು ವಾರ ಆಯ್ತು. 1 month ಇಂದ joint pain ಇದೆ. After
Simple, once again. Ashwagandha Churtam with Ghrutam. Sadhya Rasayanam for post-viral. Simple Ghrutam, the regular go Ghrutam. Internally. Ashwagandha Rasayanam.
That was